Hello, everyone. It's Monday, September the 27th. And regretfully, we've lost another 45 people since Friday. And over and over, now we're up to 3,568 total people. And over, I ask for your prayers. I ask that you won't let them become a number. I ask that you absolutely will reach out. Reach out to these families. Reach out to them in prayer if you don't know them. And absolutely, if you know them in any way, at least reach out a phone call. You know, the last thing on earth that these great people need is to feel alone. So if you'll join me in respect, the 3,500th and 68th death is a 73-year-old male from Tucker County. The 3,525th death, let me start all over. The 3,524th death is a 73-year-old male from Tucker County. The 3,525th death, a 70-year-old female from Wyoming County. The 3,526th death, a 51-year-old male from Randolph County. The 3,527th death, a 70-year-old female from Jackson County. The 3,528th death, a 78-year-old male from Monroe County. The 3,529th death, a 56-year-old female from Monongahela County. The 3,530th death, a 77-year-old male from McDowell County. The 3,531st death, an 83-year-old female from Mingo County. The 3,532nd death, a 95-year-old female from Cabell County. The 3,533rd death is a 75-year-old male from Harrison County. The 3,534th death is a 60-year-old male from Jefferson County. The 3,535th death is a 56-year-old female from Mercer County. The 3,536th death is a 76-year-old male from McDowell County. The 3,537th death is a 71-year-old female from Ohio County. The 3,538th death is a 52-year-old female from Webster County. The 3,539th death is an 87-year-old male from Wyoming County. The 3,540th death is a 61-year-old female from Kanawha County. The 3,541st death is a 68-year-old female from Fayette County. The 3,542nd death is a 30-year-old male from Wood County. The 3,543rd death is a 71-year-old male from Brooke County. The 3,544th death is a 73-year-old male from Pleasants County. The 3,545th death is a 77-year-old male from Kanawha County. The 3,546th death is a 49-year-old male from Mercer County. The 3,547th death, a 54-year-old male from Boone County. The 3,548th death, an 84-year-old female from Kanawha County. The 3,549th death, a 39-year-old male from Monroe County. The 3,550th death, a 56-year-old female from Kanawha County. The 3,551st death is an 86-year-old male from Raleigh County. The 3,552nd death, a 75-year-old female from Mingo County. The 3,553rd death, a 63-year-old female from Mingo County. The 3,554th death, a 54-year-old male from Raleigh County. The 3,555th death, a 50-year-old male from Mineral County. The 3,556th death, a 74-year-old female from Cabell County. The 3,557th death, a 40-year-old female from Mingo County. The 3,558th death, a 68-year-old female from Wayne County. The 3,559th death, a 78-year-old male from Cabell County. The 3,560th death, a 67-year-old male from Kanawha County. The 3,561st death, a 43-year-old male from Summers County. The 3,562nd death, an 83-year-old female from Mercer County. The 3,563rd death, a 66-year-old male from Cabell County. The 3,564th death, a 58-year-old female from Mineral County. The 3,565th death, a 69-year-old male from Ohio County. The 3,566th death, a 74-year-old female from Kanawha County. The 3,567th death, a 96-year-old female from Monongahela County. And the 3,568th death in West Virginia is a 73-year-old female from Brooke County. Let me tell you just this. When I started reading these, the 3,524th death, you know, I misspoke and said and called it the 3,568th death because that's the total. And then I stopped and went back. And if along the way I mess up and say something, misspeak a number and everything, please forgive me because I'm anything but perfect. But I stopped because I want to be so respectful to these people. I don't want to botch up the numbers. You know, I want it to be absolutely a time of respect because they deserve that. Now, the other thing that is surely noticeable is just this. You know, we got a lot of 70-year-olds and 60-year-olds and sprinkle of 50-year-olds all through it. A lot of 61, 68, 52s, and all through the whole thing. And then we've got some that are 40 and 43, and the other day a kid was 23 years old, I think. But in all of this, what you really should pick up on is just this. 8 months ago, when I would read this, it was completely almost 77, 85, 102, 92, 91, 88, 94, 87, 93, on and on and on. And now the ages are moving down. We lost so much of our wisdom before, and now it's taken even more. It took a slice at maybe the very elderly, and now it's taken a slice at the less elderly. You know, it's really hurt us in this state. And it surely really hurt these beautiful families. The numbers would absolutely be reflective of the fact that we are going through the peak, and it looks like we're starting to turn down. And that's great news. Our active cases are down 1,689 cases since the last update. We're at 14,534 now. Our daily positivity rate's still pretty daggum high. We still got 1,163 new positive cases. Our daily positivity rate's at 11.42. Our cumulative positive is at 5.83. It continues to rise. Our recovered cases are 217,000 and some. The number that are hospitalized are down to 978. That doesn't seem like much, but we're down from 1,008. The number in our ICU units are down just a little bit, not much. We're down from 292 to 291. From the standpoint of those on a ventilator, we're down from 195 to 193. And all of this tells us just this. It seems like we're just holding. We're in a hold pattern right at the peak. But it looks like that hold pattern could absolutely just start flowing our way. There are two green counties, the same two, Pocahontas and Tucker. A lot of really good work, I'm sure, you know, in those counties. From the standpoint of mask mandates, the only county that doesn't have a mask mandate in school is Pocahontas. Our numbers continue to drop in the hospitals as far as those that are unvaccinated. The percentage of those dropped just a little teeny bit. Now in our hospitals, we're approaching 20% of those that are in the hospitals that are unvaccinated. That are vaccinated. So just stay with me and just think through the whole process, because all this math works. If 20% of the people that are in the hospitals or there close to it are fully vaccinated, what does that tell us? It tells us that we really need to get our booster shots, because those that are fully vaccinated, if they're out past 6 months, absolutely, the effectiveness is wearing down. We got to get vaccinated with the booster shot now. So they're available, and we absolutely promote for you to move forward and get after that. From a standpoint of reminder about those that are 65 and above, if you've got any symptoms, please go get tested. We can stop this with the antibodies. I've said it 10 million times. I encourage you, if you're in a big crowd, indoors especially, if you're in a crowd of people and everything and you're compromised by age or diabetes or anything, you should probably really think really hard about wearing a mask. Like I said, the boosters are fully, they're out there, they're ready for you. We're waiting and we're trying to get, we're going to get boosters in arms just as fast as we possibly can. We're ready to go. Great work by all those from our National Guard to our local health departments, local pharmacies, healthcare facilities, all the people, that are out there and everything. And I've told you over and over that if you're 18 and above, absolutely you will qualify in some way, and you will drop into some category that will enable you to get that booster shot. So I would really highly encourage you to run to the fire again and get that booster shot. We jumped out of the gate and we led the nation in a lot of ways. Let's lead the nation in this as well and everything, and you getting that booster shot, because that will absolutely give us a positive effect on the strain on our hospitals. Because if you don't get that booster shot, the vaccinated are getting this now and having a recurrence of this. And so from the standpoint, if you don't get that booster shot and you end up in the hospital, you're putting more and more strain on the hospital. If you get the booster shot and it prevents you from getting this and everything, it will help our hospitals, and we really, really need to be trying to help our hospitals in every way we possibly can. I think for the first time, or for the second time now, this is like an instant replay. We have again crossed across 1 million people that are vaccinated in West Virginia, with the big adjustment that the CDC made when they had double counted numbers and everything, and then had to go back and make their numbers right. When they did that and everything, we dropped down below 1 million and everything, and we crawled back. That's what we do in West Virginia. We crawl back, and we keep fighting, and we're going to keep doing just that. We're back now to 64.3% of the total people that have received, the 12 and above, that have received at least one shot. We were always concerned about the fact that the fully vaccinated, people that are getting a second shot, people are hesitant about getting that second shot, and that's not really the case. We're at 56.4% of the people that are getting their second shot, so people are following through with that, and I felt like they always would, and so we just need to get more and more and more of our people vaccinated. And the other thing that I'll tell you is just this, is since the last time we were here, we have gotten 9,400 more people vaccinated, and that's pretty good. That's a whole heck of a lot better than looking at it as it being 3,400 or 4,200 or something like that. But 9,400 more people have stepped up to get vaccinated. So all we're doing, whether it be Baby Dog or me being here or all the work that's going on at WVU or wherever it may be, all the stuff that we're doing, the marketing that our broadcasters stepped up and did and everything, all the stuff we're doing is working. It's just not working good enough. We can do better. Okay, we'll be back out this Thursday with Baby Dog giving away stuff, and if you'll please get vaccinated and please get registered. Who knows, you may be the next big winner in lots of different ways, and so please get vaccinated and please get registered for this. Vaccine eligibility over and over is 12 and above. I need our parents, I need, grandparents and everything to help me get people across the finish line. Our kids really need vaccinated in a really big way. You'll see in just a second, and I think I'll read the number to you, but we've got somewhere plus or minus 1,000 kids that we've identified in the school systems that now have COVID. 1,000. We don't know what the side effects are, but there's a lot of people and a lot of arguments out there that says that the kids could carry, side effects for the rest of their lives. You don't want your kid, taking that risk. Absolutely, the risk of the vaccine is so minimal, it's unbelievable. Absolutely, get your kids vaccinated. And no telling how many kids are out there walking around right now that have COVID with very little, if no symptoms at all, but they have it. They've got it. And once you've got it, you run the risk of going throughout your life and everything and develop some form of side effect and whatever it may be. You don't need that. You don't need to take that chance. Just listen to me. I am telling you without any question whatsoever, get your kids vaccinated. It's really safe. It's really safe. Don't take the chance. I am not speaking about kids that are getting sick. I'm speaking about kids that are getting COVID that don't even know they've gotten it. They spread it. That's a real handicap and a real problem. But the worst problem, the way I see it is, or maybe an equal amount of problem, the way I see it is the fact that they can carry some level of side effect from this, and it can haunt them maybe the rest of their life. You don't need to do this. We need our kids vaccinated and need to be vaccinated right now. This is getting ready to get bad cold weather. And when we get colder weather, we're going to be inside more. And when we're inside more, it's going to spread even faster. And so absolutely, for all of us, get your kids vaccinated while we got a real chance to do it, and we'll shut this thing down. Grand families, take advantage of the school voucher that we've got out there, the $150. You got 19,000 kids with you right now. We need every one of those 19,000 vaccinated. It will only ensure you and them. Absolutely, come on, we need you really badly. From the standpoint of the COVID vaccine info line, it's all up. Get tested. We thank Fruits. We thank Walgreens over and over for all they've done. Long-term care facilities, got 85 outbreaks, 3 churches. Our churches and the church community really has done a nice job. But Monroe, Raleigh, and Wayne counties have these, and we've got to do a little bit more work there, but really the church community should absolutely be commended. Corrections, we have 286 inmates at 18 facilities and 75 staff cases at 19 facilities. That's a lot, and we're watching and everything, but you remember just weeks ago we were down, I think, to 1. And so you see how fast this thing can spread. We've told you that. It's very, very infectious, and it can spread very quickly. I remind you about giving blood. It is really important, especially in these times and everything. And our hospitals don't need to have more and more and more wear and tear on them and everything. If you can help giving blood, that really helps in lots and lots of ways. We're going to continue to help our hospitals. We're determined to help them with all their needs and everything in any way we possibly can. They got to go through, different little hoops to qualify and everything, but we're working with them like crazy and everything. And when we initiated saving our care, we first went with saving our wisdom, and that is, all the elderly folks that we were losing and everything. But now we're working, double time on saving our care and working with our hospitals to make sure that our community hospitals and everyone stays up online and everything to be able to protect all of us. From the standpoint of the flu vaccine, you can take the flu vaccine and the COVID vaccine at the same time. Absolutely, whatever you do, you should absolutely be looking at taking that flu vaccine. I think that all folks that are 6 months and older are eligible. It's something you ought to do. But nevertheless, that's all I've got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning, and in following with what the governor has said, a lot of the parameters that we follow closely, including the reproductive value, is dropped below 1 for the first time for the state in many weeks. And as the governor said, although we have been sort of staying at the plateau part of this inverted V curve, it appears that we may be starting to go down. Our average number of cases this week is down by 200 from last week, and our average number of daily deaths is down from 19 to 11. And while that's 11 too many, it gives us some reason to hope that we will continue to see declines. I also want to join the governor in congratulating all of our hospital leadership, our hospital association, our long-term care leadership, and leaders of the separate long-term care facilities, assisted living facilities, for doing a really good job this far through the pandemic. When we look at states like Idaho and Alaska and Oregon and others, we see that many of their systems are starting to fail, and ours have maintained, which I think is really to the credit of the leadership. In addition to what the governor said, it's reported that Pfizer is imminent in presenting their data on children 5 to 11 years old to be able to get vaccines. Again, remember, the vaccine dose is about a third of what the dose is for 12 and over. It's 10 micrograms instead of 30 micrograms, but it seems to be very effective in inducing a similar type of immune response based on antibody level. And just to remind everybody, as the governor said, that it is really important that all West Virginians that are 6 months out from their second Pfizer vaccine or more, who have really almost, anybody can qualify, but who are either over 65 years old, who have some evidence of chronic medical condition, which would include being overweight, having a history of smoking, any heart or lung disease, any chronic kidney disease, any kind of cancer or bloodborne disorder, diabetes, many others. And the list is available. They're shown, or people that work in high-risk industries, frontline workers, hospital workers. So please go to get your booster dose of the Pfizer vaccine. We have every belief that Moderna and Johnson & Johnson will follow. And as the governor said, we are seeing some vaccine breakthrough cases that are leading to people being sick enough to be admitted to the hospitals. And remember, if you have these same medical complications, or if you're over 65 years old, not only if you test positive, will we also encourage you to contact your healthcare physician or healthcare clinic to look at whether you would benefit from monoclonal antibody infusion, or even if you're a close contact of somebody who tests positive and you haven't tested positive, you still may be a candidate for the monoclonal antibody infusion. And if you get this treatment before your oxygen level gets low enough that you might need to have some supplemental oxygen, or you need to go into the hospital, then these antibodies can reduce your risk of having severe infection or disease by 80%. And that certainly helps you, and it helps the hospital system that we're still trying to be really thoughtful for, as the governor said, assist in the ways that we can. Thank you very much.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. I'd like to good morning, reinforce a couple of points that the governor made. It was a strong weekend for vaccinations for first doses, but we've had good success with boosters being rolled out as well. I want to don't thank enough the team from the Interagency Task Force and DHHR. Particularly thank Marty Wright with the healthcare folks and the nursing homes, as well as all of our team and team members. Will be on a Zoom with them at 1 o'clock today, but a lot of people work behind the scenes every day to make sure that those shots are in the right places across the state of West Virginia, so they can go easily into the arms of those who will take them, and whether they need a third dose, a booster dose, a first dose. So I thank all the folks that are working behind the scenes to get this done every day. Again, as the governor's pointed out before, we continue to press growth of access for sites for the antibody treatments, and organizations continue to register with HHS through our process so that we can get those out. We have made an official request through Secretary Crouch to HHS to increase our availability up to 3,000 vials a week for Regeneron, which is the shot, which is much easier to roll out. We hope to hear back soon about that increased level, and we will continue to press hard to get that out to a number of West Virginians. Last thing I'd leave you with is, after a number of different conversations with the governor Friday, Saturday, Sunday on booster doses and updates and all of those things, I reflect back on early in this pandemic when we were in an absolute panic that we might lose 64 West Virginians. And today the governor's had to read up to 3,568. And we can stop that and slow that down and quit losing great West Virginians if folks will just go out and get educated to the value of this vaccine and the value of the antibody treatment. But there's no substitute for the vaccine. It is the best treatment. So again, I encourage all West Virginians to listen to what the governor presses us to move forward with, and that is get educated, get vaccinated, and let's get past this. Thank you.
All right, thank you, sir. Secretary Bill Crouch with the DHHR is also joining us today and is available for questions. Dr. Aina Amjad, our state health officer, had a prior engagement. She will rejoin us later this week. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers. This won't be a COVID question, but this is for the governor. The Wall Street Journal reported this morning that your company's offered Credit Suisse $300 million by refinancing some of the loans that were previously done. And I think they also reported that you all have pledged to Credit Suisse half the proceeds of either a potential sale or initial public offering for Bluestone itself. I didn't know if you had any comment on that report, if you had seen that this morning, or what your thoughts were. Thank you.
Stephen, I haven't seen it. I think it's pretty accurate, but with all that being said, you know, if you'll go back and tell the real story about the whole thing, you know, we got the rug just jerked right out from underneath us, you know, with the Green Seal folks, you know, and what happened with Green Seal, and I've said it over and over, bad actors, very bad actors, and with that, you know, that we had to work through a whole bunch of hoops and everything, but I think it would be very, very premature for me to have a whole lot of comment on it and everything. I think that the Credit Suisse folks and ourselves are working together really, really well, or not myself, but my family, you know, from the standpoint primarily of Jay on the coal side. But with all that, you know, everyone seems to be working along really, really well. I've said it over and over, you know, we spend time concerned about, you know, my family's personal, you know, finances, what you know, and how that's all going. And I would just report to you, it's going very well. I mean, for crying out loud, you know, that's the last thing we need to worry about. What we need to worry about is 3,568 great West Virginians we've lost, and that's what I do night and day. I'm going to do my job, period. I'm going to do my job as your governor night and day. Absolutely, from the standpoint of my family's finances, they're great. They're absolutely great. The coal business is doing fantastic. The Greenbrier's doing great. Absolutely, let's just continue to move forward and everything. And we don't really need to be. I surely don't think that I ought to be discussing, what's going on in negotiations with them. I'm aware of it, but I'm at a distance.
All right, thank you, Steve. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if somebody could tell us about how many booster shots have we given out since Friday? Do we know about a breakdown of where they're going? And do we have plans to add that info to the DHHR dashboard going forward? Thank you.
General Hoyer, this is you, sir.
Yes, sir, Governor. So as of 10 o'clock, it looked like, Charles, we had about 13,000 boosters. I think some of that may include some level of third dose as well. We are working to see how we can better make those available, and we'll be working with Secretary Crouch and the team on additional things going forward. Part of it too, remember too, is there's a little bit of lag between when those booster doses get put in an arm and when they get reported, because our health command, our health department folks are really strapped with manpower. So it takes us a little bit of time, but that tracking number, 13,000, should be on the dashboard now and available. Thank you.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. My question today will focus on families. Number one would be a medical question. Are we seeing more families affected with more than one person getting the disease in the same household? And the second part of the question would go to the Department of Health and Human Resources. And it is when you have somebody with COVID and they have been hospitalized, the family's spending a lot of time at the hospital, of course, giving their attention to their sick loved one. Are there any services that you are directing to those folks through direct contact at the hospital, or maybe through a secondary source? Thank you.
General, I'm sorry, Dr. Marsh, you're going to have to answer this. This one's beyond me.
Thank you, Governor, and thank you, Paul. Yes, Paul, the Delta variant is much more highly contagious and much more easily transmissible than the previous variants or the initial COVID-19 virus that we saw before. Now, we know that people that are fully vaccinated are, in fact, less likely to spread COVID-19. Even though initially they may have high concentrations of virus in their nose, that dissipates quickly. So it really makes it important in a household. The delineators of spread tends to be who's fully vaccinated, and if people need boosters, who's been boosted. Also, that if somebody in the family does get COVID-19 and other family members have not, it is really important to wear masks around each other and really isolate that family member, because the Delta variant is, as we talked about before, at least 2 to 5 times more infectious than previous variants, and exists in about 1,000 times concentration of the initial COVID-19 virus in droplets and aerosols that might be produced by somebody who's infected. And I will hand off the second part of the question to Bill Crouch.
Good afternoon. Good morning. The question with regard to whether DHHR is providing additional services, we are aware that there are many families who have developed multiple cases of COVID through contact and through spread within the family. So I'm not exactly sure what you're referring to. All of DHHR services are available to folks as needed. I don't have any specific information with regard to individual families asking for information other than advice, and we do have epidemiologists on staff who do talk to families daily with regard to whether they should wear a mask, whether they should test, et cetera. So we do provide a lot of that information to families. So if that's what you're referring to, we're doing quite a bit of that. I hope that answers your question.
All right, thank you, Paul. Governor, I'll turn it back to you.
Okay, let me say this, and this is to the media. Even though this is a COVID briefing, and we always want it really to center around that in itself, but if you have a question, like Stephen, had in regard to something that doesn't have anything to do with COVID, I'm going to answer it as best I possibly can, and I welcome you to ask questions on anything, that you have. But primarily, this needs to dial in, to a COVID briefing. But we welcome those questions. And the only other thing I'd like to add to Stephen's question is just, Stephen, I don't know where. It's always amazing how people, leak different things and everything. I promise you that from my standpoint, I don't want to perpetuate leaks and everything, but I'm amazed how information comes out from time to time that I have no earthly idea where in the world it comes from. But I always want to tell you the truth. When you ask me a question, I'm going to tell you the truth. But nevertheless, in closing this briefing today, I want to again go back to just this. The booster shots are available. The number of people the number of people that are vaccinated in the hospitals today are going up. So if you're fully vaccinated, you're not completely protected, especially if you're 6 months out from the last time you were vaccinated. Absolutely, we should remind everyone, that this is a Pfizer booster. You can get a Pfizer booster now if you were vaccinated with Pfizer. For all people above 18 and you were vaccinated with Pfizer, it would be highly recommended, especially if you're 6 months out, to go get your booster shot. Go get your booster shot now. The effectiveness of Pfizer, everyone has said, is phenomenally good. But as you go further and further from your last vaccine, it begins to drop off and drop off and drop off. That's why, in a lot of ways, our hospitalizations are going up on the people that are fully vaccinated. So, I also want to comment just 1 second on General Hoyer's thing. He's dead right. I can remember like it was yesterday that a service in the state of Washington came out with a forecast for West Virginia that said West Virginia would hit 64 deaths. And we couldn't believe it. I mean, at the time we were like 9 or 12 or something like that. And I thought, my goodness gracious, please don't tell me that we could lose 64 people. And we did everything you could possibly do to try for it not to be 64. You just think of the thousands and thousands and thousands that we've lost in this country. I think well over 600,000 now. In addition to that, I can remember like it was yesterday, our president at the time, President Trump, saying the forecasts were for us in the United States of America to lose 65,000 people. There's no way. It can't be 65,000, and now it's 600 and some thousand. With all that, I would just end by just saying just this. Our kids are the most valuable resource we have, period. They really, truly are. They are so wonderful, and they mean so much to our hope, to our future in every way. We've got to get our kids vaccinated. You've got to really listen to me on this. From the standpoint of all that we know, and this is all we can deal with is what we know. But on everything we know, it says these vaccines are enormously safe. And we absolutely know that if you get COVID, There is some level of risk to getting side effects that linger on and on and on and can go all throughout your life. We absolutely know that our kids, many of them are probably walking around right now that are COVID positive and don't have a clue that that's the case. We know that there's 1,000 or they're at it that have COVID and are positive, and we have recorded that. We absolutely have got to get our kids vaccinated. So if you're parents or grandparents out there and you're listening to me, please really consider right now getting your kids vaccinated. I mean, if you'll look outside, the temperature is 70 degrees and the sun's shining. But before you can turn around 3 times, the wind's going to be blowing and the temperature outside is going to be 10 degrees. And at that point in time, everybody's indoors. Everybody's, all kinds of things are starting to happen and everything, and it'll get worse. Right now is when you need to go. Right now is when you need to get our kids vaccinated. The only last thing I would say is just this. From the media standpoint, Paul is a great man, and he talks all the time, and he's on here every day, and he's loyal as he can possibly be, and he asks great questions. One of the comments of the questions that he was asking, it involved people with loved ones in the hospital and them going to see them. And the first thing that I thought about is just this, is, going to those hospitals and seeing them and everything and sharing time with them while they're in the hospital and God forbid that we lose them, but going there is hard on those families. It's risky to some degree and all that. But the worst of all is just this. It's from whatever position, whether it be at distance or not, but watching your loved ones take their last breath, trying to breathe and they can't breathe. And there's nothing we can do to stop it. Watching a loved one, sit there and say, gosh, I wish I'd have gotten vaccinated. Can I still get vaccinated? And the doc says, can't do it now. Really and truly, not in the condition you're in now. I can't do it. So with all that, it is a terrible death. A terrible death. And absolutely, and God super forbid, it happening to our youngest of our youngest. But absolutely, with all in me, I tell you over and over and over, please really consider vaccination. We're always going to be respectful of your freedoms, all of our freedoms, and we're absolutely going to continue to always be respectful of that. But please, right now, before it gets cold, before that wind is really blowing and everything, and blowing in a bad way, please consider this vaccination. We can shut this down. Thank you so much.